Now let's go for the approach to transfusion reaction by signs and symptoms. Well, if you have fever, chills, and rigors within 6 hours, what you will think of? You will think of febrile non-hemolytic transfusion reaction. وقلنا the approach انه انت تطالع في التمبريتشر. what happens to the temperature؟ هل بتزيد temperature by 1 degree؟ معناته هنا this is worrisome. اوكي حتقلق. طيب لكن اذا زادت by less than 1 اوكي ممكن I resume the transfusion. طيب hemoglobinuria, flank pain, fever, hypotension, you will think of acute hemolytic due to intravascular hemolysis. Jaundice at day 5 or day 7 بعد الترانسفيوجن معناته you are dealing with delayed hemolytic transfusion reaction. Dyspnea within the first 6 hours معناته it's either trally, taco or severe allergy within 4 hours. طيب severe allergy usually بتحصل within 4 hours. Now إنما التاكو والترالي within 6 hours. Now dyspnea plus high blood pressure, this is taco. طيب dyspnea plus hypotension, this is trally. So one way to differentiate between trally and taco is to look at the blood pressure. لأنه both of them بيعملوا dyspnea. When you look at the blood pressure مع taco, you will find high blood pressure due to high volume. When you have a lot of volume, you get high blood pressure, right? Basic physiology. إنما مع trally, you get hypotension. طيب dyspnea plus hypotension with rash within 5 minutes of the transfusion. Oh my God, very quickly. So the patient very quickly develops a rash, hypotension, and dyspnea. So this is anaphylactic shock. So if the patient gets fever and hypotension, it could be septic shock, it could be acute hemolytic, or نسميها كمان أحيانا hemolytic shock. طيب. So fever and hypotension could be septic shock, could be acute hemolytic, or it could be what? It could be anaphylactic shock. If you have a rash within 5 minutes of the transfusion plus hypotension and dyspnea, think about anaphylactic shock. ليه؟ لأنه الانافيلاكسس بيحصل فيها bronchoconstriction والانافيلاكسس بيحصل فيها a lot of histamine release and a lot of other mediators اللي بتعمل لك ايش hypotension وبتعمل لك كمان rash وكمان بتكون very quickly within 5 minutes of the transfusion, right? So please think about anaphylactic shock. طيب now gingival bleed purpura 5 to 12 days بعد the transfusion. Think about post transfusion purpura, post PTP, post transfusion purpura. في entity تبع الكومبليكيشن اوف ترانسفيوجن اسمها بوست ترانسفيوجن بيربرا بتحصل بعد 5 الى 12 يوم من الترانسفيوجن وبيجي معاها بيربرا لايك بليدنج. اوكي يعني البيشنت بيصير عنده سكين بيربرا او بيصير عنده جينجيفال بليد يعني بليتلت لايك بليدنج. يعني ايش بليتلت لايك بليدنج؟ احنا عندنا تو تايبس اوف بليدنج، اما بليدنج بسبب ديفكت في البليتلت او بليدنج بسبب ديفكت في الكواجوليشن فاكتورز. platelet defect بتديك ميوكوكاتينوس بليد. احد امثله الميوكوكاتينوس بليد هي الجنجيفال بليد. انما الكواجوليشن فاكتور ديفكت بتديك bleeding في الجوينتس، bleeding inside the brain, bleeding inside the abdomen, right? bleeding inside the muscles, right? طيب. Now acute rash less than 3 hours plus it involves less than 2/3 of the body. So again, the patient عملنا له transfusion وجاه rash within less than 3 hours. نطالع في الراش نلاقيها ماخذه less than 2/3 of the body. So this is minor allergic reaction. طيب نفس السيناريو ادينا البيشنت blood ودخل في rash within less than 3 hours of the transfusion انما more than 2/3 of the body معناته this is severe allergic reaction. طيب now if the patient develops acute rash within 5 minutes and it is more than 2/3 of the body, this is anaphylaxis, right? So how do you differentiate between minor and severe allergic reaction? الماينر تكون less than 2/3 of the body والسيفير تكون more than 2/3 of the body وboth of them بيكونوا less than 3 hours of the transfusion. Now what about the anaphylaxis? Anaphylaxis بتكون very quickly, less than 5 minutes of the transfusion. Now this is a very nice slide that summarizes the approach by the symptoms, by the respiratory symptoms. What happens if you have respiratory symptoms after the transfusion? Okay, this is another slide.